Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. The gastrointestinal system is a long, muscular tube that begins at the mouth and ends at the anus. It is divided into the upper GI tract, from the oral cavity through the esophagus and stomach, and the lower GI tract, which includes the small and large intestines. Food travels through a well-organized path starting at the mouth, which also includes the teeth, the tongue, and the palate. Then it moves through the pharynx and esophagus, then through the stomach and the small intestine, through the duodenum, jejunum, and ileum, then finally through the large intestine, which includes the cecum, colon, rectum, and anus. The accessory organs help, but don't touch the food. The liver produces bile, the gallbladder stores bile, and the pancreas secretes digestive enzymes. The GI system performs digestion, both mechanical and chemical, absorption, and elimination. Next, we're going to list the common diseases of the GI system, so please pause the video at any point when you need to review the definition of our term. Disorders related to eating include anorexia, dysphagia, and polyphagia. Disorders of the oral cavity and salivary glands include glossitis and sialothiasis. Diseases of the esophagus and stomach include dyspepsia, gastroesophageal reflux disease, also known as GERD, gastritis or gastroenteritis, peptic ulcer disease, and stomach cancer. Disorders of the small intestines includes ileus, intussusception, and valvulus. Disorders of the large intestine and colon include appendicitis, colon cancer, diverticulitis, celiac disease, and IBD or IBS. Disorders of the rectum and anus include hemorrhoids, proctitis, and rectocele. Defecation issues include constipation and diarrhea, and steatorrhea. Abdominal wall disorders include hernia and peritonitis. Liver disorders include ascites, cirrhosis, hepatitis, hepatomegaly, jaundice, and liver cancer. Disorders of the gallbladder and bile ducts includes cholecystitis, cholelithiasis, and cholelithiasis. Disorders of the pancreas include pancreatitis and pancreatic cancer. The diagnostic and radiologic procedures include both laboratory tests and imaging. Some laboratory tests you may run across are the CLO test, which detects H. pylori, the fecal occult blood test, which detects hidden blood, and the liver function tests. Imaging includes the barium enema and the UGI series, CT MRI scans, gallbladder ultrasound, cholangiography, and cholecystography. Some medical procedures include the nasogastric tube, or NG tube, for draining or feeding, and an enema, which relieves constipation. Some common GI drugs include antacids, antibiotics, antidiarrheals, antiemetics, H2 blockers and proton pump inhibitors, and laxatives. Common surgical procedures include appendectomy, cholecystectomy, polypectomy, bariatric surgery, colostomy, endoscopy, gastrectomy, herniorrhaphy, liver transplant, jejunostomy, gastrostomy, and cholecystolithotomy. The GI system is vital for digestion, absorption, and elimination. Understanding its anatomy and common disorders helps us recognize symptoms early and manage care effectively.